We know that the work of the Embrace Project has made a difference for the caregivers coming to the organization. And we can see from the results of the survey that our work is making a difference. From the very beginning of our project, we heard loud and clear that caregivers wanted a place to go. We developed this space, the Change and Care Embrace Family Caregiver Center, just for those caregivers. Caregivers now have a quiet place to go, away from the hustle and bustle of the busy inpatient units. A great advantage of this caregiver center as well is we really want it to be a symbol for the staff in the organization. They walk by it every day. It's very central in their minds that we value caregivers at the Cornwall Community Hospital.
It begins with awareness, and I have to say that in our journey, that's where we started. It was really to bring our frontline providers to the point where they could really appreciate the impact that the caregivers can have on the delivery of service to our clients in need. I just can't say enough how important this project is.
We heard that one of the stresses caused by family caregivers is their loved one being discharged, and they didn't know much about the hospital stay. They didn't understand the discharge instructions, and they also didn't know when they should seek help again after their loved one came home. We worked in a co-design committee with a number of caregivers and providers to develop a checklist that we actually give to the caregivers the day their loved one arrives. Looking at the checklist and knowing what's in it helps cue the provider as well in making sure that they have all the information that they need to be able to safely take home their loved one. In the addiction and mental health system, the privacy and consent legislation really seems to get in the way in a manner that doesn't happen for other medical reasons. And it really caused a disconnect between the care of their loved one and their communication with the healthcare providers, and a lot of frustration for the caregivers. We were able to create a document that shows how healthcare providers and caregivers can understand this legislation and use it together to help them provide better care and support for the caregivers and for the patient. Early on in the project, we heard about a subset of caregivers. They're called the young carers. We were able to bring together a number of these young carers and hear from them what they needed. Some of the young carers on this committee had really challenging family lives.
We know that there is a high incidence of addiction and mental health issues in our community. We see that both through our emergency department, through the inpatient hospital, and of course our community care programs. So the dependence on our programs and our need to deliver service to this population is important. In the past, these family caregivers were largely invisible, and we want to change that.
Opening up was not easy. It took time, and it took a supportive environment. What made it successful is that this group was led by a young carer who had been through a very similar journey.
I grew up facing a lot of challenges with the mental health system and trying to navigate it for my father. I remember going to the first Change and Care event about young carers, and I would not talk about my story. But through the Embrace Project, I felt comfortable enough to talk about it. It gave me a platform to speak about it. It provided me with a great team who recognized my role and who supported me. And it also allowed me to meet other people who were just like me experiencing these sort of things, and to learn that, you know, some of the anxiety I was feeling around my caregiving role was normal, that we were all facing it. Through the Embrace Project and the work that we did to figure out what the youth needs are, we came to the conclusion that a really important aspect of this was identification and recognition of young carers. We created a decision tree that clinicians can use to figure out if They might be in a caregiving role, and then on the back, it's what you can do now that you've kind of recognized that you're in that role. And it's been really nice to have clinicians come up to me and talk about the success stories with the algorithm. They said it was really important because they would have never thought to explore that topic with youth until the algorithm came out. So that was really, really great to see. One thing that we created was a zine, and that was a way for the youth in the group to really get their messages out into the community and into the larger population, to let them know who young carers are, the role and responsibilities. We had some coping mechanisms, we put resources in there, and that was their way of getting information out. They said that a regular poster might not work, but having these in the school libraries or in the offices or whatever it might be would be really helpful. One of the best and most rewarding things has been the reactions of the youth who have finally felt like they've been seen and they've been heard. There have been tears shed and some really great stories shared with me about the change that this identification and that this advisory committee is giving to them. I know a lot of youth feel really invisible whenever they're in this caregiving role, and none of their friends typically are in the same role. There's often no other young carer in their world. So for them to know that there's a group coming together and that there's people who hear them and who see them and who are working to help them, that's a huge thing. The Young Carers work is not stopping. The Young Carers in the Advisory Committee have been invited to join a group of youth who are creating change within the city and within the province, so that work will continue to grow. I'm confident that we're still working towards creating meaningful change.
We had to spend significant time defining what a caregiver was. And now I see the word caregiver across the organization. I hear caregiver language being used by the staff, and I hear caregivers saying that they are now being identified, and caregivers are starting to recognize that they are caregivers. Before we started this project, the word caregiver wasn't a word that was used consistently. We really learned how to work together as a team and accommodating and supporting each other as we had our various needs. And we were able to use that experience to become even more passionate about helping the caregivers in our community.